Thank you so much, Dr. Bolad, for coming on Wellness Your Way. I'm thrilled to have you here.
Well, thank you, Megan. I'm very glad. I'm very happy to be here as well.
Yes, thank you. And we were just discussing before, and I was saying that your passion for your work shines through. I am very honored for you to be here sharing information about heart health with all of our audience. But I'd love to just start with a little bit more about you. Can you tell us about yourself?
Thank you, Megan. Yes, I am a board-certified cardiologist and interventional cardiologist. I trained in so many different places in Europe and in the United States. I have got over 30 years of experience as a physician and over 20 years of experience as a cardiologist.
Wow.
I practice in a teaching hospital. I train residents and fellows. And I also have got this passion of trying to help people about heart disease and heart health.
Incredible. Well, thanks again for the work that you do. And let's just start with some background. When we talk about heart disease, I know that's a pretty general term. So can you define heart disease for us and maybe talk about some of the risks for the average person?
So heart disease is any disease that involves the heart. It can be from the common symptoms that we know about, like chest pain, and that is usually a manifestation of coronary artery disease, which is the commonest form of heart disease. So coronary disease is one subset. Other subsets are valve disease of the valves of the heart. You have also got, apart from the valve disease, conduction abnormalities of the heart. Okay. These are the arrhythmias. This is also classified in the umbrella of heart disease. And in addition, structural heart disease, basically abnormalities in the structure of the muscle of the heart. All these come under the umbrella of heart disease. So this is heart disease broad. People generally think of heart disease of sudden onset of chest pain, feeling unwell, but this is just one subset of it. Heart disease covers a lot of things.
Understood. And what percentage of people will experience heart disease during some time of their life?
Well, the incidence increases with age. You can be born with heart disease as congenital heart disease from birth, but generally the incidence of heart disease increases with age as we move on and as we get older. So in about above the age of 60 or 70, you expect about 10% to have at least some sort of heart disease, but the percentage can be higher in different populations. So it's very prevalent.
Yes, very prevalent. I think everyone knows someone who has, or at least has heard of someone who has experienced heart disease. And it has that stigma or that fear around it, because I think even when I grew up, the common knowledge was like, you'd just be fine walking around one day and then boom, a heart attack would come out of nowhere and you had no warning signs and you did nothing to cause it and it just strikes you down. And I think that notion is changing, but still there's a fear in people that could happen. And I think, I'm not the cardiologist here, but I think that's a lot more rare than we believe it to be. Is that true?
This is true. Also, just to inform the audience about what's happening. So there is cardiac disease and there is cardiovascular disease. And cardiovascular disease is even broader. And that involves not only the heart, it involves the vascular system in general, and also involves events that occur in other parts of the body, for example, like strokes, etc. So if we go to cardiovascular disease, the incidence is higher, and that includes things like, for example, high blood pressure. You find the incidence is much higher, and the incidence would be like 20 to 30% in the general population when you go above 60 or something like that. Now, to come to the point about the sudden onset of symptoms, etc. So usually there is a buildup of disease that you don't feel and just happening all the time. For the person to get only suddenly severe chest pain, etc., this is really a manifestation of something has been brewing on all of a sudden. It reached a level that, for example, when you get a heart attack, there happens to be a crack in the plaque inside your coronary artery.
Mm-hmm.
So there is like a tear in the atheroma.
Mm-hmm.
And just like when you cut yourself here in your skin, a clot forms, right?
Yeah.
The same process happens in the arteries in the heart. When there's a crack in the plaque that has been building, a clot forms in the artery, and that blocks the flow of blood to a segment of the muscle of the, and that's the manifestation of acute onset of symptom,
Mm-hmm.
which is a small subset of what's happening. Is the majority of people will be experiencing exertional chest pain as they go on, increased shortness of breath as they do their activities. So the sudden onset of chest pain is manifestation of an acute event, but the
Yes.
great majority of things are the chronic conditions, which has been going on for a long period of time.
Understood. And even in that case of the acute onset where there was a little tear and then a clot, is it true that in order for that clot to be fatal or to cause very serious issues, there was probably already some plaque buildup? So maybe it was a little bit of a chronic buildup, even though they didn't feel it. And then that one event led to the clot, which led to the very serious outcome.
You are 100% right, Megan. And there has been studies with intravascular ultrasound. That's basically a small probe we put in the arteries of the heart during invasive procedures in people who come in with acute heart attack. So these studies have looked at the arteries that were blocked after they got opened. They do ultrasound in them to see what is happening and to look at the other arteries that were not affected. And it has been found in over 50% of cases that there is already plaque buildup in the same artery and in different arteries in the heart. So this is absolutely correct. It is a buildup that has been going on over a period of time, and it's a chronic condition that manifested acutely because of an event.
Yes. And what are some of those things that will lead to the chronic buildup of plaque in our arteries?
So the risk factors obviously are what we always talk about.
Yes.
And there are the traditional risk factors and the non-traditional risk factors. So things like high blood pressure is a very common thing. And these people really underestimate it. It's very important to control your blood pressure because it damages your arteries all over the body, including the heart. It's also known as a silent killer, and that's always what I remind my patients to make them aware of how significant high blood pressure is.
Yes.
High cholesterol levels, okay, are also very, very important. If you have got high cholesterol, it's going to build up somewhere, and that's what is going to eventually lead to the plaque and to the heart attack. There are one important risk factor which nobody has got control about is the family history. If you come from a family that your parents and lots of people in the family suffer from coronary disease and heart disease, then your risk of getting it is going to be high. You are born with it. You really cannot change it, but you can try to modify other factors in order to reduce the likelihood of it progressing, etc. And it's just like a lottery. You are born with it, and then you just have to really accept the fact you are prone to it and work harder in order to alleviate the progression or reduce the risk of progression.
Yes.
So family history is very, very important. Other risk factor, for example, like smoking. Obviously, I'm sure that all of us know that smoking is harmful. People just take a risk when they smoke, they're not knowing how bad it is affecting all the arteries of the body, not only the heart, the brain, the neck, the legs, the up, everywhere. Okay, important. So these are like the traditional risk factors that we usually talk about in general. Non-traditional risk factors is, for example, like your mouth health and your dental health.
Oh.
Very important. I mean, people, you will not imagine how important this risk factor is. If you have got bad teeth, it's a reflection that number one, you're not looking after your body as in general.
Yes.
So it's unlikely you will have bad teeth and gum disease, and you will be looking after your health.
Right.
But also more important, it's a manifestation of chronic disease happening here. And that chronic inflammation is pouring into the circulation all the time, causing inflammatory changes all over the body. So this is an important risk factor. Poor sleep or lack of sleep, the stress, okay, is a very important risk factor.
Yes.
Also in developing, it's a non-traditional risk factor. Depression. If you are depressed, you are not going to be looking after your body. And depression is a non-traditional risk factor for lots of people. There is another risk factor, for example, like pregnancy. Pregnancy in itself is you get high blood pressure, and with it, obviously, some people develop long-term high blood pressure after pregnancy that continues on. That's what traditional risk factor. So there are modifiable risks and there are non-modifiable risks. You can't do anything, for example, for pregnancy, but you can always try to control it. You can't do anything about your family history, okay? But there are other modifiable risk factors that you can work on to make sure that your heart and your body in general is healthy on the long term.
Amazing. Thank you for that. And just to give people some hope, if they're thinking, oh no, I do have heart disease in my family, what you're saying is it's true that your risk is higher. There's nothing you can do about that, but you can do things about smoking and stress and sleep and managing your diet for cholesterol and managing your blood pressure and exercising and all these things. And it's not a death sentence. It's not that even if your family has that in its history, you're definitely going to get heart disease. It's just that you have to work a little harder, like you said, correct?
Absolutely. This is absolutely true. This is absolutely true. You are absolutely right here. So you can just work harder on getting things done, and improving your health in general.
Great. Let's talk a little bit about cholesterol, which is one of your top 3 traditional risk factors. I think me being in the holistic nutrition world, people tend to go too far to the side of cholesterol doesn't matter at all. And then you being a cardiologist, people tend to be like, you have to get as low cholesterol as possible. And probably the right answer is a bit nuanced. I believe that the ratios, for example, are very important and that total cholesterol doesn't tell us the whole picture. So can you share any thoughts about this?
You're absolutely right, man. The total cholesterol is just like a rough estimate of what is happening. If you want to be more precise about your risks, etc., the ratios and the fractions are much more important than the total cholesterol. So, for example, if you have got a total cholesterol, say above 300 milligram per deciliter, then definitely you are at very high risk. But the majority of people don't have that. They have got it like between 100 to 200, just above 200. So the question is, this is a gray area. How can you differentiate your risk? Okay. Also, the other hand, if you have got a total cholesterol of less than 100, then you're obviously low. So when it's too high and when it's too low, it's clear cut. But the gray area in the middle is different. So, in order to look at the individual risk, we need really to look at the fractions and have to compare the different fractions to the total cholesterol. So one commonly used one is the ratio of the total cholesterol to the HDL cholesterol. And to the audience, the HDL cholesterol is the good cholesterol in your body. And a ratio of like 3.5 to 4 to 1 is really, you need to get it below that. Is really good because then you will have a protective effect on the body. And then the ratios of the HDL to the LDL. But in general, and I just wanted to make it simple to the audience to understand what's happening here. Number one, you have to look at the bad cholesterol rather than the total cholesterol. The bad cholesterol is the LDL cholesterol. And the LDL cholesterol should be average in general, less than 100. And if you are high risk, you should get below than 70 milligrams per deciliter. Okay, if you have got a higher risk. Your good cholesterol, which is HDL cholesterol, you should get it if it is lower than 35 milligram or 40 milligram per deciliter. You should get it to that level or even higher. And that's obviously by modifying your risk factors, eating healthy, foods that increase the HDL cholesterol, etc. So these are the fractions that we have to look at and to try to get the ratios right and the numbers, absolute numbers, right as well. So I agree totally with you. Total cholesterol is like a miss. Oh, my cholesterol is 200. I'm okay. No, we don't know what is happening. You need to dig deeper. You need to dig deeper and to figure out what is happening to find out your individual risk. And in the current day and age, we have got very potent medications that can help reduce the bad cholesterol and increase the good cholesterol as well. I don't recommend it to be like the first line, but for some people who are struggling, there are a lot of people now on it. As a matter of fact, I am taking it. I don't have coronary disease and I don't have an immediate family history, but when I look at things and my knowledge about medications and about health, I decided to take it. So you can always be helped by medications if you can't get it straight or just by diet, etc.
Interesting. Thank you for sharing that. I'd love to just reiterate a couple things that you said and then add on one question. So one is that the ratios are very important. And for you, you're paying attention in particular to total cholesterol to HDL. You said under 3.5 to 4. I'm surprised that my ratio is even stricter. I like to try to get my clients 2.5 or lower just to get a lot of that cholesterol from HDL.
The lower the better, absolutely.
Yes, the lower the better. So
the lower the better, right?
That's great.
Absolutely,
so,
yeah.
Even that person with a cholesterol of 200, which I agree with you could be borderline, if their HDL was 100, that's a totally different story than if their HDL is 35, because for the audience who doesn't know, and no one really needs to remember this formula, but I believe it's HDL plus LDL plus triglycerides over 5 equals total cholesterol. So if your HDL is low and your total cholesterol is borderline, that just means that you have too much of the LDL, which is the bad cholesterol, and the triglycerides. And that's the question. Triglycerides. I think those are just as important as the other two. What do you think about triglycerides?
Absolutely right. People forget about this all the time. Triglycerides are very important as well in the development of atherosclerosis, and they need to be controlled as well. So when you look at the lipid profile, you don't only look at the cholesterol, but you also look at the triglycerides.
Yes.
Now, there are some diseases that make the triglycerides go up high, and therefore you need to control them. Statins do help in that, but there are other medications that also we lots of the time prescribe in order to get them. So levels of triglycerides are also important, not to be forgotten in the overall picture of just talking about the cholesterol. Your triglycerides are also very important, and they need to be kept under check.
That's great. Thank you for sharing that.
That's absolutely.
Now, I'm curious about statins and other medications. I agree with you. They're super helpful for some people, and that many people can get this under control with diet and lifestyle. I wonder how you decide as the cardiologist, if a statin will just lower everything too much. It's lowering their HDL, it's lowering their LDL, and they were already pretty low. How do you decide on that?
So statins have got the benefit of lowering the LDL and increasing the HDL. And as you said, it is not a straightforward formula. To give you like a background, and that's like a historical background and probably shows my age. Honestly, when I graduated from medical school, whatever your cholesterol level was, you should not prescribe. We were not allowed to, we were recommended not to prescribe medications, because all the medications at that time showed that there is increased risk of death due to other causes from people taking cholesterol medications.
Yeah.
And I'm mentioning this because that really plays into the equation of when should you prescribe it. Then in the, I would say in the 1990s came these big studies called the 4S studies.
Okay.
And that is using a statin called simvastatin, which is the oldest statin we have. And that was the first study that clearly showed benefit of statin and reduced events, cardiovascular events in people taking statin. And then obviously better statins came into the markets with less side effects, etc., etc. Going back to your question, it's always, you have to take everything into consideration when prescribing it to people. It's not without its side effects. Side effects are rare. Side effects include, for statin, include the common ones, liver disease and muscle issues, acute muscle issues that can be serious, like rhabdomyolysis. Some reports about possible cognitive decline on the long term, etc. But these risks, everything we do in life, Megan, is risk and benefit.
Yeah.
Today, if you are crossing the street, there is a risk of you being hit by a car. Now, are you going to stop crossing the street because there is that risk? No, the risk is so small, right?
Yes.
And so it's exactly the same thing here. So when you get someone with, say, for example, say borderline cholesterol level, I have to look at, does he have any symptoms? Does he have any evidence of vascular disease? Does he have family history? Does he have that person other risk factors?
Yes.
Like, for example, diabetes, kidney disease, etc.
Yes.
If any of these apply, then even though he might not have any coronary disease, I would still recommend that they go on statins.
Yes.
And to lower the total cholesterol, and to lower the LDL cholesterol, and to increase the HDL cholesterol, and lower the triglycerides to a lesser extent.
Yes.
So all these there is no straightforward formula here, unfortunately.
Yes.
And you have also to involve the patient in the decision making, because the patient is going to be the one who's going to be taking the medication, and he or she will be the one who's suffering the side effects if or should they occur. So you really need to get the patient involved in this. You don't just take a unilateral decision. And that's one mistake I found about lots of patients who come to my practice, saying that A, I was prescribed this, I don't know what it's for, or B, I'm getting these symptoms and what it can be for, the medication. So getting the patient involved is very important in the decision making after taking all these risks and benefits into consideration.
Yes, absolutely agree. That's great. So we focus a lot here on nutrition, since that's one of my favorite aspects of health. And I saw a YouTube video that you put out about your favorite foods for heart health. I just loved it. I'd love if you could share some of your favorite foods or the best foods for heart health with our audience.
Okay, so obviously we all the time say we have to eat healthy, but what does me eating healthy is, and what sort of diet should we be following?
Yes.
And as a nutritionist, I'm sure you are very familiar with, and you probably know better than I do in this regarding the different diets, including the Mediterranean diet, which is my number one diet.
Yes.
And I recommend it to every person to eat. And that's because the favorite foods are the foods that have been found to reduce the risk of coronary and heart disease and cardiovascular disease in general, increase longevity with less side effects on the long term.
Yes.
So I'll first give you the background about the diet, just to share with your audience. I'm sure you know it better than I do.
It's great to hear from another voice other than mine. They're sick of me.
That's okay. So the Mediterranean diet is high, as to the audience here, it's vegetables, fruits, nuts, a lot of nuts, olive oil, and I'm talking about not the standard purified olive oil. I'm talking about the extra virgin olive oil, which is unpurified. It is very important. In addition to smaller portions of white meat. Yeah. So this is really the summary of the Mediterranean diet. And people in that part of the world, in the Mediterranean area, have got less incidence of cardiovascular disease.
Yes.
And that's where it all came about, really. Let's look into their diet. What do these people do? So, with that background, the important foods for good cardiovascular health are, number one, foods which are high in vegetables.
Yes.
Like spinach, like broccoli, like tomatoes, etc. So all these have got very important components, and from antioxidants to vitamins, etc., that help with the cardiovascular health.
Yes.
Similarly, fruits, also high fiber, in addition to vitamins, in addition to some antioxidants, especially certain fruits like, for example, the berries, the strawberries and raspberries, etc. Grapes, especially the red grapes and the black grapes. And that is one of the reasons in France they have got much lower incidence of heart disease, because they consume a lot of red wine from the grapes, and that is the reason, or it is behind the theory of what Europeans term as the French paradox. So the French have got lower incidence. Why? Because they thought because of the red wine, because of the grapes. So vegetables, fruits. Number three, and very importantly, nuts. You find that Mediterranean diets have got a lot of nuts in them, and all the nuts from walnuts to the seeds, etc. These have got very important things in them, apart from the fibers, but also antioxidants, etc.
Yes. So
you should be eating a lot of that. One thing is olive oil, and I touched briefly on it. If you are using oil, your audience, please try to use olive oil, and not only olive oil, concentrate on the extra virgin olive oil. We abbreviate it as EVO, EVOO. And this is very, very important. Now, regarding the meats, all of us, well, most of the people like meat, including myself, and you should concentrate more on the white meat rather than on the red meat.
Yes.
And your diet should be comprised of lots of things like fish and poultry, rather than steaks and red meat. Yes. It doesn't mean that you should deprive yourself of red meat. No, you can eat red meat, like unprocessed red meat.
Yes.
Not processed. Unprocessed, whatever you like, but in a portion not more like 10 to 12 ounces in a week of cooked weight. Okay, not more than that. Now, processed food is a complete no-no. And the reason being, the processed food, you don't know what is in it, because lots of things are mixed in it. Number two, there are preservatives in it, the chemicals that are put in it to increase its shelf life. It contains salts. It contains other chemicals to make it taste nice. So all this, when you're eating this processed food, you're putting lots of chemicals into your body that you don't know what is in them. And these have been proven without doubt that in eating processed meat increase the risk of cardiovascular disease and overall health and overall death as well.
Yes.
Not only that, there are also an increased risk of cancers with them, like colorectal cancer, like prostate cancer, like breast cancer.
Yes.
So all these, and that's not, if you think about it, if you say it to someone for the first time, they wouldn't believe it, but you're taking really chemicals, and these chemicals are working negatively in your body because of what's in that processed food. So processed food is a complete no-no. Lean unprocessed food, you concentrate on the white meat. If you like red meat, you can eat like not more than 12 ounces in in a week.
Yes.
In a week. Yeah.
Yes. Oh, that was so much wonderful information. Thank you for that.
No, this is really important, because that's how you can take care of your body and of yourself and of your heart.
Yes, absolutely. So the listeners have heard me shouting the benefits of vegetables, but take it from a board certified cardiologist. That was the first thing on your list: vegetables, fruits. And then some people are surprised by nuts and olive oil and fish because they are high fat foods, but they're exactly the right types of fat. So those fats are really great. It's the fried whatever vegetable oil that they're using in fast food restaurants that's recycled, and all of those junky fats that are really not great for our heart. But the right fats, the nuts and extra virgin olive oil in particular, those are great.
Absolutely. No, I cannot agree more. Yeah, absolutely.
Great. And then just reiterating what you said, the red meat, the processed red meat is for sure, and processed meat overall, for sure linked to increased risk of heart disease and some of those cancers and overall risk of death. However, we both think that I recommend 1 or 2 servings of good quality unprocessed red meat per week. That's okay. There might even be in your YouTube video, which we'll link below as well, because it's so great, there might be a yellow, so not a benefit or not a detriment. But for many of us, that's worth it, especially people who are low on iron or people who just really enjoy 1 serving of red meat per week or something like that. You're giving that an okay, true?
Absolutely right. Yeah, I totally agree with that. That's what the data shows. And therefore, I totally recommend that.
Great. That's why I love your YouTube videos so much, because you're not saying, I believe, or I want this to be true, or this is my opinion. You're very grounded in the data, which I think we need in this day and age of social media and craziness all over the place. We really need people who are grounded in the data. So everyone listening, please check out Dr. Bolad's YouTube video. We'll, of course, link that in the show notes.
Thank you. Yeah, absolutely. Whatever we do has to be evidence-based.
Yes.
And that's very important.
Absolutely. So I have just a couple more quick questions. You harped on processed food, which I completely agree. And you said additives and chemical preservatives and things like that. One thing that I didn't hear you say is sugar. And most people don't associate sugar with heart health, but I do, because of metabolic disease being so related, diabetes and heart disease, et cetera. So can you tell us about sugar and heart health?
Absolutely. Increase intake of sugar. There are different types of sugars to start with, just for the audience, okay?
Yes.
There are the monosaccharides, disaccharides, polysaccharides. There is obviously the table sugar that we get. There, that's glucose and fructose. But overall, data shows that increased intake of sugar it has been associated with increased cardiovascular risk of death, and increased also risk of other issues, including cancers as well. But going to the heart, cardiovascular disease is increased by you taking increased intake of extra added sugar.
Yes.
I'm not talking about the sugars that you are taking, for example, your oranges or your bananas or berries. No, I'm not talking about that. And that hasn't been shown to be, that actually has been shown to be fine and good.
Yes.
Okay. But the added sugar, you should not take a lot of it, if any, if you can help it, in a day. And what the American Heart Association recommends is that for men, they should not take more than 9 teaspoons in total, and that's in everything. And for women, it shouldn't be more than 25 grams in a day. And to put that into context, for men, it should not be more than 9 spoonfuls, and in women, should not be more than 6 teaspoonfuls. And that is really little. If you look at any of the ingredients in any food or on any drinks, you can easily, they tell you about the serving and about the added sugar. That's what you should be looking into, the added sugar. And that's really very little. Sugar. And that really underscores how the American Heart Association, based on the data, recommends that you should not increase it. Otherwise, you are exposing to yourself to a high risk of cardiovascular disease and heart disease and increased risk of death. So sugars are important. You don't need, for example, if you drink lots of coffee, like I do, unfortunately.
Don't need all the sugar in it.
No sugar, no sugar
good.
at all. Absolutely. You don't need any sugar in it. You don't need to take sweeteners. Actually, as a matter of fact, sometimes when I ask for coffee and someone's giving me sweetened coffee, it doesn't taste good anymore to me. I'm just so much used. I just used it without being sugar. So you can always adapt your lifestyle and your drinks to a form in which added sugars are not there. Okay.
I agree completely. I used to not like coffee, and I used to sweeten it a lot way before I got into the health field. And I had to wean my way off of it. So go a little less, a little less, a little less. And now, just like you, sweetener or sugar in my coffee does not taste good. And I'm very grateful for that.
Absolutely. Yeah, absolutely. And you also, from people, you're talking about healthy stuff, actually coffee, and that lots of my patients, probably lots of your audience as well, would think that coffee is bad. No, coffee is good. Yes. My patients come, doctor, how many coffees can I take a day that is healthy for me? I said, well, coffee is good. Take it in moderation. It's good. All the studies have shown that coffee is good, improves cardiovascular health for sure. Yes. You should, the moderation, you should take it in moderation. In moderation means about 6 cups of 8-ounce ones, 6 of them a day, about average, because that's what most of the studies have looked into. That's why that's number, my number.
Yeah, but unless it interferes with your sleep, right? So I don't think you're suggesting, especially for slow metabolizers, 6 cups of coffee at 8 p.m. Like hopefully more throughout the day. And every individual knows their own body. We all oxidize it at different rates and metabolize it differently. So if it's not interfering with your sleep, take it from Dr. Bolad. He's saying 6 8-ounce cups of coffee per day. I love it.
Up to six. I did nothing. Okay. I did not imply that you should go and drink 6.
I do 2 per day.
Absolutely, yeah. But you can take up to 6. That's what the data shows. Up to 6 of 8-ounce ones are good for you.
That's great. So helpful. So you've given us so much great information already. If you could boil it down to 1 or 2 takeaways that our listeners could do starting today, what would your top takeaways be?
My top takeaways, and that's what I tell my patients here, Megan, is that look after yourself and look after your body as if it's your car. And that's what I tell my patients. If you look after your car, you service it regularly, you put the good oil, you put the good gas, you clean it, anything that goes wrong, you fix it, then that car would last you for a long period of time.
Yes.
Your health and your body is very similar to that. You need to look after your health and body in order to have a healthy life. It does not happen by coincidence that you just develop a healthy lifestyle and you look healthy.
Yes.
It needs work. It's a part-time job.
Yes.
Therefore, before eating anything, when you go grocery shopping, go as if you're going to a pharmacy. You are picking the best foods which are good for you and for your body.
Yes.
Choose the right vegetables, the right fruits, etc. And don't avoid the risk factors. For example, you don't want to crash your car. You want to be careful in parking it. You don't want to be careful in cleaning. The same thing for your body. Don't abuse it. It's a part-time job to get healthy. So that's my takeaway to the audience. You look at your body and your heart health as a part-time job, and if just think about what you do for your car, to keep it running for a long period of time. So to keep your body running for a long, healthy period of time, you have to look after it.
Oh, I love that. I think I treat my body a lot better than I treat my car. So my poor car, it's going to make it. But I think the analogy is so great. We would never put, I don't know, Coca-Cola into our car gas tank and expect it to operate. And yet we think our body should just be operating at peak no matter what we put into it. It does not work that way. So thank you for clarifying that and using that analogy. I know it will stick with people.
Yeah, and that's what I tell my patients all the time.
Yeah, great. Well, this has been so wonderful. I know listeners will want to find out more. I will hope and urge them to go to your YouTube channel. Is there anywhere else you'd like to direct the audience today?
I also, as I mentioned, I answers lots of questions a lot. So for anyone who have got a heart disease related questions, they can visit my website, drbolad.org, and that's the full word of Dr. DOCTOR, bolad.org. You can find lots of information about heart disease and heart health. And importantly, there is a button. They say ask a free question. And it is educational. Obviously, I'm not your doctor, but I'm more than happy to provide you information about heart health and guide you in the right direction. So if you have got any heart disease related question, click that button, send me your question, and I'll reply directly to your email, and it's a confidential one. So that's how I answer lots of questions from patients from all over the world, by the way, all over the world. I've got audience from Europe to Australia to Asia to South America. So feel free to ask a question and I will answer it. I ask usually 24 hours, you'll get an answer.
That is such an incredibly generous offer. I cannot even imagine how you do that. We were chatting before we were recording, and Dr. Bolad says he does answer every single question, which I just find amazing. So if you do have a question, audience, go on over to drbolad.org. We'll put that link in the show notes and feel free to ask a question. And one more time, Dr. Bolad, thank you so much for your time today and your insights and wisdom. We all really appreciate you coming on Wellness Your Way.
Thank you very much, Megan. I'm happy to help anytime.